All right, well, good afternoon, everyone. I'm Stefano Grande. I'm the CEO of the Children's Hospital Foundation of Manitoba. I'd like to start off by acknowledging that CHRIM and the foundation are located on the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and the Dene people, and on the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. Well, what a year 2020 has been. Who would have ever anticipated just a few months ago that we would have a whole new reality, a whole new language, PPE, social distancing, flattening the curve. As generous supporters of the foundation, we wanted to give you the opportunity to hear firsthand from some of the special folks who are helping us better understand and translate this new language in this new COVID-19 world and what it means for kids and their families. We've been very fortunate in our province to have seen very few cases overall and very few cases in kids. But that doesn't mean we don't have experiences with COVID. In fact, we are incredibly fortunate to have the Children's Hospital Research Institute of Manitoba right here in our province, led by Dr. Terry Klassen and researchers like the four you will meet this evening, leading national and international studies on COVID-19 and its effects and impacts on kids. Our foundation provides $4 million of funding annually for the operation of CHRIM. Your support is vital to making sure we have a strong institute that tracks and retains important work like this research that we will be learning more about this evening. A couple of housekeeping items. You should be able to see and hear the speakers on your screens. Audience microphones are disabled for events like this, so you don't have to worry about muting your line. If you have questions for the panelists, please use the chat button on your screen to ask. We hope to have time to answer some after the presentations. I'd like to now introduce to you our moderator, Brittany Greenslade. Many of you will be familiar with Brittany from Global News Winnipeg, where she is a senior reporter and anchor. Thank you all for being with us here tonight, and over to you, Brittany.
I am very excited to be here to moderate this today. We have some incredible researchers here. I've been spending the past few days reading up on all of the work that they've been doing, and I'm really excited to hear a little bit more about what's happening. So how this is going to work is we're going to have each researcher and panelist is going to present for a couple minutes. I will ask a couple questions to each of them after. We're also going to take questions from each of you as well that we'll be able to ask at the end as well. So first off, I'd like to introduce you to who we have here today. We're going to start with Dr. Meghan Azad, and I have to read these off of here because you guys have impressively long lists of accomplishments behind your name. So Dr. Azad, who's a research scientist with CHRIM, Associate Professor and Canada Research Chair in Developmental Origins of Chronic Disease at the University of Manitoba. We have Dr. Lauren Kelly, who's a scientist with CHRIM, Assistant Professor, Departments of Pediatrics and Child Health and Community Health Sciences at the University of Manitoba. Dr. Terry Klassen, CEO and Scientific Director, CHRIM, Professor, Department of Pediatrics and Child Health at the University of Manitoba, and Dr. Nathan Nickel, who is a research scientist here with CHRIM, Associate Professor, Department of Community Health Sciences, University of Manitoba. We could go through all of that with just the titles behind each of these researchers, but right now I would like to first off pass it over to Dr. Terry Klassen, who's going to give us a little bit more on his research. Dr. Klassen?
Great. Well, thank you very much, Brittany, for that kind introduction. And thank you, everybody, for coming on this beautiful Winnipeg afternoon. As you heard, I'm Dr. Terry Klassen, and the CEO and Scientific Director of the Children's Hospital Research Institute of Manitoba. And you can see the emblem of that behind Brittany. That stands for CHRIM. I'd also like to take this time to thank our partners at the Children's Hospital Foundation of Manitoba, Stefano Grande and his amazing team that helped to organize today's event, and really gives us a great opportunity to be able to say the fantastic research that's happening here. I'm just going to flip over to my slides now, so I'm going to first of all talk a little bit overview of CHRIM very briefly, and then I'd like to also talk about my own scientific involvement in 2 international projects of COVID-19 research. So what exactly is CHRIM? Well, it's closely associated with the Children's Hospital here at HSC. It's also associated with the University of Manitoba. We have 2 floors of dedicated research space within the John Buehler Research Center. Our major supporter is the Children's Hospital Foundation of Manitoba, and they support us to the tune of about $4 million a year. But this is one of the best investments that I'm aware of. That investment is multiplied times 4. So we really have about $20 million a year in research funding, and the rest comes from national funding agencies and other partners that we work with. We're organized around, we get clinicians and researchers working together on addressing substantive problems that children in this province are facing. The biology of breathing group addresses that. The diabetes research, envisaged and accomplished in Manitoba, addresses what I'd say is the epidemic of diabetes. A very new research theme is the excellence in neurodevelopment and rehabilitation in child health, or the enriched theme. Of course, the research support unit helps to support all clinical research and basic research, and is a wonderful supporting unit that helps to foster, and within the COVID-19 era, really help to make that happen. An emerging group that I'm working within is the Manitoba Emergency Care for Research for Kids. And this group has been very involved both nationally and locally on emergency research for kids, also knowledge mobilization through the program called TREC. And the 2 projects that I'm going to talk about today are nested within this research grouping. To date, it's probably in the last 10 years brought in about $15 million of research within this province. So where does my story start in terms of the COVID-19 research? I mean, a lot of these things, the trajectory actually goes back to 2009, when the world was experiencing its last pandemic with H1N1 in the spring of 2009. And that fall in Amsterdam, as part of my sabbatical, I spent some time at the University of Amsterdam. I brought together all the pediatric emergency research networks around the world. And that fall, we sat in the Amsterdam Medical Center and we said, how can we galvanize? So we want to work together. There were 5 pediatric emergency research networks. What is a key question? And of course, we all looked at it, and we knew our colleagues back home were battling and fighting with H1N1. And so we said, let's do a collaborative research around H1N1. And that really led to the formation of what we call the Pediatric Emergency Research Network. Today, it's now an umbrella network for 8 pediatric emergency research networks around the world. You can see that PERN, as we call it, went on to publish a landmark paper on H1N1 infection in children. And it really, in the British Medical Journal, which is a very prestigious journal, and really helped us predict which children with H1N1 infection presenting to the emergency department were at risk of severe disease. And that really helped to guide clinical practice back in 2009, 2010. And that was really the first of a number of successful research projects that PERN brought together. So let's roll the clock forward. And so this year, I also, generously supported by the university and CHRIM, I was allowed to do a small sabbatical. I was in the San Francisco Bay Area, spending time at UC Davis Health and Stanford Medicine, when we started to hear of a new pandemic that was emerging. And Canadian Institutes of Health Research came out with a call for COVID research. And so I called my colleagues at PERN, and I was working with some of them at UC Davis, and I said, you know, we have the experience with H1N1. Let's galvanize that experience and bring together this global research network, which is already functioning and doing high quality research, but let's make an application. And you can see Dr. Stephen Friedman at University of Calgary, or Dr. Anna Funk from University of Calgary, Dr. Nathan Cooperman, and Dr. Todd Florin from Northwestern Ontario were the principal investigators on this new initiative. And so you can see that we responded to the first call in March 2020. We got about 630,000. And the next call, which came a few months later in June 2020, and got another 500,000. So what are the two projects that we were able to do? So the first project really looks at the clinical characteristics and outcomes of children presenting potentially affected with SARS-CoV-2 who are presenting to pediatric emergency departments around the world. So we had 50 emergency departments across 19 countries. There were two major research questions. First of all, we wanted to identify factors that would identify cases that are confirmed test positive and see what are the factors that make them likely to score positive compared to those that are suspected but test negative with a constellation of symptoms. The second major goal of the study was to identify factors similar to H1N1 study, children who would experience severe outcome among those affected with SARS-CoV-2 infection. And so we've already started to recruit. Our aim is to recruit 12,500 screened patients. Of these, we expect about 2,500 will be positive for SARS-CoV-2 infection or COVID-19. And of that, 50 will be children and youth with severe outcomes. And so this would really help to guide clinicians in terms of who is at risk and who can get really severe disease. The other more recent study, and this is a very relevant, if you read the newspapers nowadays, is aimed at understanding household transmission dynamics and viral load among asymptomatic SARS-CoV-2 infected children. Here we will be focusing on North America, 20 sites across the US and Canada. We'll be recruiting 400 asymptomatic children with SARS-CoV-2 infection and match that to 1,200 uninfected children. And then we'll look at who in the household becomes symptomatically infected with SARS-CoV-2 infection. And of course, this has a major implications for school and other activities. And this again is in the midst of recruiting patients. So in summary, I'd like to say that foundation funding through your generous donations has allowed CHRIM to be a vibrant and dynamic research organization that can quickly respond to the research needs of Manitoba children and families. We have some of the best child health researchers internationally right here in Winnipeg, and you're about to hear from some of them, 3 of the brightest lights we have here in Manitoba. By working closely and being intimately connected to the Children's Hospital and its healthcare providers, it means we can ask the right questions and that answers can quickly be applied to clinical care and health policy that makes sense for families and for children. So thank you very much for listening. And you have some other really amazing presentations that are coming up. I'm just the appetizer. Now you're about to move to the main course.
Thank you so much for that, Dr. Klassen. I have so many questions for you that we are going to get to in just a little bit. Very curious to know your thoughts on a lot of things that are coming up with school going back. So we will touch on that in just a few minutes. Thank you for that. I'd like to pass the microphone over to Dr. Azad for all of your research now.
Thank you. Is my screen showing up? Good. Yes. Okay. Well, thank you everyone for tuning in today on this summer afternoon and for supporting our research at CHRIM. So my name is Meghan Azad. I'm the co-lead at the Manitoba site of the Child Study. And I'm happy to be here today to share a little bit with you about our COVID-19 research in the Child Study. So I first want to acknowledge that I'm just one member of a very large team. So this is our Child Manitoba team. As I'll show you in a moment, Child actually has centers in BC, Alberta, and Ontario as well. So there are even more people across the country that have contributed to this study. And so I'm happy to be here on behalf of all of them. We've also had support from your foundation as well as many others over the years. And of course, the real heroes of this study are the families and the children who participate. So this is our famous child wall in the lab, where we actually have been back for a little while now, but these are many of the children participating in the research that I'll share with you today. So what is the Child Study? This is a study that's been going on for over a decade now. It's a longitudinal birth cohort study, meaning that we recruited women when they were pregnant about a decade ago with the goal of understanding how genetics and the environment shape health trajectories in childhood. And we take a very broad view of the environment. So we look at things like air pollution, we look at the indoor home environment, We think about nutrition and socioeconomic factors and stress and infections, because we know that all of these things play an important role in shaping health and disease trajectories early in life. So as I mentioned, it's a very large study over the years. We've had 3,500 families enroll in the study. It involves over 40 researchers across the country, spanning multiple disciplines from pediatrics to environmental science to psychology. We've collected many samples. Breast milk is underlined there because in my day job, that's what I study, although now it's turned to COVID research. Many questionnaires have been completed over the years. We've already published over 100 papers from the study, and we've been following these families for 8 and more years. So where does COVID come into all of this? Well, this is a linear view of the study. So you can see that we started in 2009 recruiting moms. We connected with the families when their babies were born, and then every year or so thereafter. I've got on here the poop samples and the milk samples. That's what I normally use to study the microbiome. But as you can see, we're right now in the midst of the 8-year follow-up, and pandemic hit. So we were about halfway through our visits in March of 2020, and we had to very quickly shut down all the visits. So we had the families and the children coming into CHRIM to visit us. We do allergy testing, lung function testing, and other things, but all of that had to stop. So while our research team was at home thinking, you know, when will we ever get to resume this study? What should we do in the meantime? We realized that this is something we really had to capture. We plan to follow these children if we get the funding until they're adults, and maybe even follow their children. And so this is something they're all living through right now. Whether or not they become infected with SARS-CoV-2 and develop COVID-19, which we hope not many of them will, they're all living through the pandemic just like all of us, and that's a very stressful situation. So we wanted to firstly capture that so that we could then continue to study how it might affect these families. But we also realized that we had a really unique opportunity to perhaps learn something about the virus itself. So we applied to the Canadian Institutes of Health Research, and we're fortunate to be funded along with Research Manitoba to study COVID-19 in the child study. It's a pretty long title, but the important parts are that we're studying the prevalence and predictors of SARS-CoV-2 infection. So why do some people become infected and others people don't? Why do some people develop mild symptoms or no symptoms and others become very severely ill? And then also we're looking at the health and psychosocial impact of the pandemic overall. So to explain the study, this is sort of what we had going on in child before the pandemic hit. So we had collected 10 years worth of data on these families, which include 3,500 children plus their parents. So altogether over 12,000 individuals across 4 provinces. We have already studied their microbiome profiles, their genetics, their immune profile, their health status for their entire lives. We've looked at the socioeconomic factors in their environment and so on. And what we're going to do now is collect new information during the pandemic. So these families will be answering for us on a weekly or bi-weekly basis what symptoms are being experienced in their family, if any, whether any of them have been tested for the virus. They'll also be completing every 3 months a more extensive survey about their mental health and well-being, their behaviors, their worries and changes in lifestyle during the pandemic. And then we'll be doing a repeated antibody test, and this will all be done at home. So we're conscious that having children come into the hospital during a pandemic could be quite problematic, especially depending what happens this fall. So we've designed the study such that we're mailing out to them a kit where they can send the samples back to us for testing. We're harmonizing this research with some other cohorts around the world in the US and Australia to make it comparable so that that can maximize the type of conclusions we can do. And again, we're looking at those predictors of infection, but also the indirect impacts of the pandemic on things like social isolation, stress, food insecurity, and so on. And then a primary goal of this funding opportunity through CIHR was to rapidly translate this information. So I think probably all the speakers today would agree that this is an unprecedented time in research where getting the results fast is really important. So we've engaged people on our team from public health authorities in each province and nationally to be able to get the information to them as quickly as possible and to have their opinion up front in terms of what information is important for them to know. So we'll be providing that information in order for the governments to be able to do modeling and to understand more about the COVID-19 disease and infection. And then on the other side, we'll also be feeding that data to the appropriate agencies for them to understand what kind of impact this is having on stress and the economy and be able to plan for those types of activities. And then finally, not part of this grant, but I think equally important, is the fact that we'll be embedding all of this information in the child study, which is going to continue afterwards. So we'll be able to look at the long-term impact of either becoming infected or living through this pandemic on physical and mental health. So that's it for me. This is my final slide. It says, keep calm and child study on. This is actually a poster made by one of the children in our family. We had coincidentally planned a poster competition for the kids in the study, and it occurred just as the pandemic was starting. So it ended up being kind of a nice homeschool activity for the kids to do. And if you want to see more, we had over 200 entries. You can visit our website to see what the kids were up to. Thank you.
All right, thank you so much, Dr. Azad. And now that we've heard from two researchers, I do want to say once again that all of this work is made possible by donors and the donations that are put forward to CHRIM. So we welcome those donations. They can come at any time, and it is helping with some incredible research. I'd like to now welcome Dr. Nicol to speak a bit on COVID-19 and First Nations, Métis, and Inuit Canadians and research that's being done there. Dr. Nicol.
I think you're muted, Nate.
Sorry about that. Let me just go back and share my screen. There you go. Can everyone see my PowerPoint slide? Yeah, okay, great. Okay, so I'm really happy to speak with you today about some work that we're going to be doing looking at COVID-19 testing. To begin with, I wanted to set the stage for why we decided to do this project. We know, based on the experience from H1N1, that some folks in Canada are likely to be hit harder by COVID-19 than others. And including in these are First Nations, Métis, and Inuit populations. We know from H1N1 that that pandemic hit those populations harder due to systemic factors such as experiencing poverty, living in systemic racism, and experiencing underfunded services. And so the concern was that this same pattern would exhibit itself during the COVID-19 pandemic. We also have seen from other countries' experiences with COVID-19 and with other similar pandemics that testing is one of the first steps to keeping the spread of COVID-19 down and to protecting children and families. By doing routine testing and contact tracing, we're able to effectively flatten the curve, which is something that's been in the media quite a bit over the past several months. So researchers at the University of Manitoba began to build a partnership specifically targeting COVID-19 with folks from the First Nations Health and Social Secretariat, the Manitoba Métis Federation, and the Manitoba Inuit Association, along with representatives from the healthcare system, in order to identify what are some of the big needs that each Indigenous group is going to need in order to address this pandemic. And so the idea of being able to routinely monitor testing in different communities and identifying barriers to testing floated to the surface as a real need for addressing the pandemic as it moved forward. Some of us on the call might be familiar, but not everyone. Manitoba is home to one of the richest data repositories in the world. We have what's known as the Manitoba Population Research Data Repository, which is a suite of databases that includes information on the entire population. So we're not subject to things like response bias or failure to capture people. Everyone in the province is included in this data system. And our partners said, what if we leverage this powerful data system in order to look at what's happening with COVID-19 testing for the entire population, and then look at it separately for each individual, each Indigenous group. Look at it amongst Métis, look at it amongst First Nations, and look at it amongst Inuit. And so we developed a project where we would use the repository to map out where testing sites are located, where we're finding positive and negative results from COVID tests. We'll do modeling within the data to identify barriers to testing at the individual level and at the community and structural level. And then we'll be meeting with different healthcare providers, different system level decision makers, both at Manitoba Health, but also for each of the Indigenous organizations to develop strategies to improve testing, access, and removing barriers to testing. We've also partnered with some data scientists in order to develop data algorithms. As Dr. Azad mentioned, one of the key components of the funding calls was in order to feed back the information on a routine basis. So we're developing algorithms to automatically generate reports that can be used in real time in order to target resources in order to slow the pandemic, the spread of the pandemic in Indigenous communities. So some of the benefits that we've identified by doing routine testing and identifying where testing gaps exist, we can better target resources so that testing is occurring in communities that need it most. We're going to be able to share our lessons with jurisdictions on how to minimize the spread of COVID-19 amongst Indigenous communities globally. We know from the US that Native American communities have been hit hard by COVID-19. And so some of the lessons around how to scale up testing sites and removing barriers to testing that we acquire from our study can be shared with some of our partners south of the border. And then as well, we're working with data visualization experts in order to figure out how best to communicate our findings, not just amongst academics and in peer-reviewed journals, but in means that can meaningfully inform decision makers and resource allocation at the system level. And with that, I will hand it over.
All right, thank you very much, Dr. Nicol. And I'd like to just take a moment here to remind everybody that there will be a time for our guests here to ask questions to our panelists as well. So you could just use the chat function at the bottom of the Zoom call here, and that's where you can put your questions in, and we will get to those in just a little bit. I'd like to introduce now Dr. Kelly, who's going to touch briefly on the Solidarity Project, which focuses on blood plasma research.
Hi, everyone, and thanks for joining us tonight and inviting me to share a little bit about some of the clinical trials that are happening related to COVID-19 here in Manitoba. So when the pandemic first hit, early on in the pandemic, there were a lot of different drugs that we talked about and hypothesized about and studied in cells and animals that we thought might be helpful for combating the coronavirus. Unfortunately, well, fortunately and unfortunately, in the last few months, we've been able to knock a few of these candidates off the list. And this is through a lot of global collaboration, one of which I'll talk about today. Here in Manitoba, we actually have ongoing clinical trials looking at 4 different treatments. And we see corticosteroids here in green, as there's now been international consensus around the usefulness of a drug called dexamethasone. And this was proven in a large clinical trial done in the United Kingdom. And that's something that we've been able to implement into care here already for patients who are hospitalized with severe coronavirus infections. So our goal here in Manitoba when the pandemic hit was to establish a COVID-19 clinical trial team. So this team is led by Dr. Ryan Zaranchansky, and you may have read a little bit about it in some of the media features. And really, we assembled to be able to offer every patient in Manitoba treatment for COVID-19 under the rigorous support of a clinical trial. There were no treatments for coronavirus, and this was the recommendation by the World Health Organization that we should be studying medicines in the context of a clinical trial and not just making guesses and trying treatments without any evidence. So the first trial that I got involved with was called CATCO, which is the Canadian Treatments for COVID-19. Initially, when I got involved with this study back in March, it included pediatric patients, which is probably why I was asked to help co-lead it here in Manitoba. Unfortunately, when we joined the WHO Solidarity Protocol, we did have to eliminate enrolling children. So that was a bit of a sad and happy moment for me. It's really exciting to be a part of the WHO Solidarity trial. This is an adaptive trial. And what that means is that we get to change what drugs we study as evidence accumulates. So this work is being done at a global level. There are more than 40 countries participating in this trial. It's the biggest clinical trial in the world, so it's really exciting for us here in Manitoba and in Winnipeg to be able to participate. Globally, there's been more than 7,000 patients that have been randomized, and Canada's number 6 on the recruiter list. So we have 39 active sites in Canada. I think we're behind France, Iran, Brazil, some of the countries that have a wider spread outbreak. And we have 3 sites that are at various different stages of activation here in Winnipeg, at the Grace Hospital, at HSC, and at St. Boniface. When it comes to Canadian children, we've heard a lot that Canadian children are less affected by COVID, maybe not necessarily less infected, but they are less likely to have severe symptoms. So here in Canada, we've had over 9,000 children test positive for the coronavirus. That includes 135 children that have been hospitalized, and 27 of them required intensive care. Fortunately, there's only been 1 death. In contrast, in the United States, I believe the last numbers I saw were they've had, over 330,000 infections in children. They've had, thousands hospitalized, and they've had 86 deaths. So you might have seen, I think there were 7 deaths in children in Florida just in the last couple of weeks. And one of the big challenges is that we don't know about the long-term impacts. So even children who have mild infections, we're not sure what that means for their long-term development. And what we're learning about some of the adults that are recovering from infection is that there are potentially some changes and some impacts on heart, on your lungs, and on some of the other organs that are critical for functioning. So it's really important for us to have safe and effective options for children with coronavirus. Although they are hospitalized at a lesser rate, this is important in terms of reducing morbidity or the long-term side effects, but also in pandemic preparedness. So as we head back to school in September, we're not really sure. No one has the right answer as to what's going to happen. And so we need to make sure that we're studying treatments for this pandemic and the next. So one of the treatments I'm going to talk about is convalescent plasma. And convalescent plasma is a blood product that we collect from individuals who have recently recovered from COVID. So their body has produced all of these rich, glorious antibodies, and we isolate that and then transfuse it to individuals that have new infections. So the Concord Kids trial, or the convalescent plasma for children with coronavirus, is what CONCOR stands for. This is a trial that's being supported here by our CHRIM Research Support Unit, and which is made possible, of course, by all the wonderful donations that they receive. And it's sponsored by Canadian Blood Services and HEMA Quebec. And it's a great, again, another opportunity, and this trial really has an equitable lens. They're trying to get convalescent plasma out to every province, and it's also being run in parallel with the study in adults as well. So why did we choose convalescent plasma? Initially, there were several options that were discussed, and there is some low quality evidence. And when I say that, I mean case reports, some observational study, that plasma may reduce death, reduce days on a ventilator, and have a reduction in the amount of time spent in hospital. But the real benefit of plasma is that there really hasn't been any adverse events, nothing serious that's been reported. Blood transfusions happen for children for other reasons, so we have some idea about the safety. The challenge is that it's really resource intensive to collect. So we have to have infrastructure to recruit people who recently recovered, convince them to donate their plasma, process it, ship it. And so in order to fund that infrastructure, we really need strong evidence that this is effective at helping children and adults recover from COVID. And the only way to get this answer is, of course, clinical trials. So thank you, and I'm happy to take any questions.
All right, thank you so much, Dr. Kelly. Again, I'd like to remind everybody you can put those questions in that chat function below here. I do have some of my own that I'd like to start off with first. Dr. Klassen, how has the work you did with H1N1 helped shape or change the approach you've taken for your research project when it comes to COVID-19?
Well, it really was, it created a very strong platform. We had trusting working relationships. We'd had great scientific output from what was an ongoing collaboration. And so we were very poised when the opportunity came here in Canada to apply for this and now roll this out globally. It's a different virus, it has different characteristics, but everything we learned about how to work together, how to do data sharing and do contracts around the world, how to do the research ethics, really was learned from our initial experience. And it's great to see. I mean, I was the initial chair of the PERN group. That leadership has now moved. Dr. Stuart Dazil is the current chair. He was the first author of that first study. So we're creating this whole generation of researchers in pediatric emergency medicine that will ensure that for years to come, as the world faces different threats or other things, we have a vibrant, functional research network that can respond and produce the knowledge in a timely way.
Yeah, we've seen a lot of collaboration with researchers around the world when it comes to COVID-19. Dr. Kelly, we've heard a lot about hydroxychloroquine since the beginning of COVID-19. I almost misstep over that because it's such a long word, but everybody wanted to know, was this going to be it? And people wanted to scrutinize it. There was high levels of speculation. So when it comes to your research, how does that speculation, that scrutiny, that spotlight shape your research or hinder it or make you feel as you're going into all of that?
Sorry, I think I was on mute there. I was going to say I can't do an interview and not discuss hydroxychloroquine. So we actually didn't randomize any hospitalized patients to hydroxychloroquine here, but we did participate in 2 of the outpatient trials. And so we have been, no one wanted hydroxychloroquine to work more than us. We spent, I can't even calculate how many hours back and forth with Health Canada and ethics boards, both in Canada and the United States, to get these trials running in record time. Obviously we were a little bit disappointed, but the evidence did show us that there really was no benefit of using hydroxychloroquine, at least in an outpatient setting. Certainly in terms of the media, there's pros and cons. I mean, there's benefit because it gets shared quickly. So there's lots of uptake. There's lots of people reading the studies. They get published open access. They get shared hundreds of times. The downside is there's a lot of scrutiny on the studies. These were studies that were conducted remotely. As Megan pointed out, we're trying to keep people out of the hospital. So we're not going to make you, if your symptoms are mild, we don't want you to come into the hospital. Please stay at home. And so, the scrutiny is definitely higher. But I think, overall, the collaborations that have formed, I think every group has mentioned that around studying these drugs in real time has just been extremely impressive and hopefully will continue moving forward.
And I guess quickly on that vein as well, how difficult is it when everybody around the world is pushing so quickly for treatment, for vaccine? All eyes are on doctors and researchers right now more than ever.
Absolutely. And that comes with a lot of weight on our shoulders to get things done quickly and to balance the rigor of clinical trials. I mean, anyone who's done clinical trials will tell you these take a year to set up and get contracts through legal and ethics boards. And, we have to work with Health Canada. And there are very big challenges about doing international studies. Some countries allowed pregnant women into our hydroxychloroquine trials. Health Canada did not allow pregnant women. There's lots of different barriers that we're learning about, but certainly the media plays a huge role, and we definitely got our share of hate mail about how our study was done and what we should have done differently, which I didn't necessarily, it wouldn't be normal in non-pandemic circumstances.
I can tell you, as somebody in the media, we are used to hearing and getting the hate mail as well. So we thank you for your research and everything you're doing through that, because I know that that can be a difficult and trying time. Choose to ignore it. That's my advice. Dr. Azad, you've been following children for years with your research, testing them every year throughout a whole bunch of different variables. The interesting part that I find is that you did some testing at the end of last year, and then now COVID has hit, and your next round of testing will be kind of at the end of next year, November, December. What specific variables are you going to be looking for in that testing, and what are you hoping that that might be able to tell you about the effects of COVID on children?
Yeah, that's that question you just asked. I think you touched on something that's really exciting about the child study and unique, which is that we have been seeing these children for their whole life, and the most recent round of testing was really still ongoing when the pandemic hit. So that means for many of these children, thousands of them across the country, we've just collected blood samples that we can use to test for immune function, microbiome samples that we can analyze. And this will allow us to see what their immune status was like, what their microbiome was like just before the pandemic hit. And then we're following them forward to see, well, which ones of them developed infections or became ill or transmitted the virus or didn't. And really there's no other study or few other studies with that rich amount of just pre-pandemic data. You know, many studies are ongoing right now to collect samples now, but the pandemic started, right? No one can go back in time and collect those precious pre-pandemic samples. So we're excited about that opportunity, and also thinking very carefully about it because there's limited, you know, milliliters of blood. What are the important tests we need to do? We always knew they were valuable samples, but they've become exponentially more valuable now. And then on the sort of indirect mental health side, we've also been asking these 8-year-old children about their feelings about mental health to the extent that you can in a young child, and the parents as well. So that allows us, again, to have this starting point of pre-pandemic, and then seeing what types of people are, you know, resilient to this stressful experience versus which ones are really suffering. And I think that's really important information that we'll be able to glean from the study.
You've been speaking with these kids and testing these kids over the years. Has there been any sort of weariness for parents and kids going into this to say, maybe I don't want to know what kind of effect this has had on me over the past few months, or the effect it's had on my children?
You know, time will tell, but we did definitely reach out to families during the process of planning this grant. We think that's a very important part of planning any research study, is to ask your participants or would-be participants their opinions of what you're planning to do. So we have a parent advisory council in the child study of parents that have been involved all this time. So we reached out to them to say, you know, here's what we're planning to do. Like, would this be too much? Are you guys, you know, too stressed? Would a survey this long be okay? Could we ask you every week or every 2 weeks? And of course, you know, not every family is the same. But really, for the most part, we found that most families couldn't wait to get involved. I think myself as a researcher, although I'm not an infectious disease researcher, as soon as this pandemic hit, I felt like, what can I do to contribute? And so here is something we can do within our study. And the families felt the same way. They thought, like, this is a massive world issue. Like, what can we do? And they view this as something that they can do to contribute for the greater good. And really, that's why they joined the study in the first place, right? In contrast to a lot of studies that look at a particular disease of people with that condition, who are often motivated. You know, if you have allergies or you have inflammatory bowel disease, you're often motivated to contribute to research because you want to improve that condition. But remember, these were all perfectly healthy pregnant women when we enrolled them. They didn't have any diseases or conditions per se. They joined the study to be able to contribute to the greater good, and this is just another opportunity for them to do that.
We are so lucky to have so many incredible researchers on this panel. You guys, the work you're doing is just, I have no words, and I'm somebody that uses my words on a daily basis. So, Dr. Nicol, when we look at Indigenous populations, you spoke already that we see higher rates of heart disease and other long-term health conditions. So why, when it comes to something like COVID, is it really important that we focus on these groups that might already be seeing higher rates of other diseases and viruses and illnesses?
Yeah, so there's a few thoughts that I have to that. One is, like, just first starting off, why we wanted to look at the testing is while we're still waiting for clinical trials to tell us what treatments are effective, what vaccines are effective, we really are relying on physical distancing measures, testing and contact tracing. And so being able to monitor the spread of the pandemic in those communities is really critical to informing a public health response while we wait for treatments. And in these communities, some of the earlier research suggests that there's pre-existing conditions interact with COVID to result in worse outcomes. We also know that in these communities, it's more difficult to follow physical distancing guidelines and physical distancing measures. Right now, I'm coming to you from my house out in rural Manitoba. I'm the only one probably within a couple of kilometers of me. It's really easy for me to physically distance, but not all communities have that benefit and have that capability. So being able to put resources into place in order to prevent the spread of the disease in communities that might find it more difficult to enact physical distancing and other public health measures while we wait for treatment is really, really critical at this early stage of the pandemic in Manitoba.
In your discussion, you talked a lot about seeing populations, First Nation, Indigenous populations being hit really hard in the US. Here in Manitoba, we fortunately haven't seen that. How much do we look to the US to see what's happening there? Or are we just our own beast here and say, you know what, thankfully we're doing really well?
I think that there's lessons that we can take from the US of what isn't working as well, and adopt more evidence-based strategies to prevent the spread of the pandemic. We've been really fortunate here in Manitoba. We have a very strong public health system that has created guidelines that have been really effective at slowing the spread of COVID-19, and as well in different communities to prevent folks from coming inside the community, which might serve as vectors for bringing the disease in, COVID in. So I think that we can look down to the States and the experience there to see what isn't working as we've seen it play out, and also just what might be impacting supply chain and resource allocation. So a really big key right now is how the health system can respond to prevent supply chain interruptions, not just for testing, but once we get treatment strategies in place as well.
Dr. Klassen, I've got a couple more for you as well. We are heading back to a new school year in just a couple weeks here. I know from the parents that I've spoken to, people are really concerned to be sending their kids back to school. The research that you're doing that focuses on asymptomatic children and how they can possibly spread the virus to other kids or to adults. Can you speak a little bit about that and what parents should know and be aware of before their kids go back to school?
Right. Well, let me first of all say that, I mean, I think we have the Department of Education and our public health people that, have put together an early plan, and that plan will be, increased in strength as new knowledge and evidence comes. So I think we leave it to them to develop that. I mean, unfortunately, we don't have the results of our research study as yet. What seems to be emerging is certainly that for a while people thought, well, are kids really important in transmission? And it does indeed seem that there's emerging evidence that children are one of the ways in which they can infect other children, but also adults in their lives. So that's an important consideration to take when you look at reopening schools this fall. So I do think that as we've seen from the stuff coming out from government, that it's going to be an opening that will be incremental. They started something in June, learned something from that. That we need to somehow keep in mind what's happening within the school environment in terms of, the distance between children and the type of ventilation that exists there. A hot question that is, should kids wear masks, 10 and over? Some evidence from the federal people that maybe that is a good idea. So I think that's going to be an important consideration to look at. And I think it's all nested in what is our community transmission rate, which is an evolving thing. And, what it was in July might be different than what it is today. And, what will it be like in September? So that's another important consideration that Dr. Rusin obviously has said that he's following and will use to make that sort of decision. So I think the knowledge and evidence is growing. I think it's important. We know there's importance for kids to be in school, in terms of learning and mental health. So that's weighed against the risk that might be for them themselves acquiring infection, and rarely that becoming more severe, or for that to be a mode by which they could transmit to adults in their lives, or adults who may have underlying conditions or other things that would predispose them to serious illness. So those would be important considerations. So I think it's an evolving thing, and I think you know, the knowledge is growing in strength. I think parents are an important constituency to listen and to hear from them. I think the teachers and the Department of Education are another one, and then I think the scientists and the public health people are the other really important group to listen and to see what is the latest evidence and data at that point to make the best decision.
Just before we end, I do want to lighten it up just a little bit. I've been working from home, like I would imagine most of you guys have. Working from home during a pandemic comes with its own challenges. What has been the biggest challenge for each of you? We'll start with you, Dr. Klassen. What do you find the biggest challenge during this pandemic has been for you? And it could be as simple as, you know, the working from home with spouses or children, or hey, maybe not being able to go out to a restaurant for a few months. What has been difficult for you?
I think I'm a very social person, and I think I've really missed, you know, obviously I have my small bubble that I interact in, that's wonderful and amazing, but I do think that broader, you know, social interaction is something I've really missed. Obviously, I've gotten some of it through, you know, the various digital platforms. I have to say honestly that it doesn't replace human-to-human interaction. So I myself will really relish the day when we as humans can interact in a closer way, and you know, and I think, you know, what I've discovered is we think, oh, just have a Zoom meeting, but I think scientific curiosity interaction, you know, it's that spontaneous going to the hallway to talk to someone that really helps the magic happen within science. I know that's a you know, kind of a funny term, the magic within science, but I do think that we're missing that, like, you know, and so I think not that science is stopped in its track, but I think it's missing that creative interactional ingredient that I myself, why I love science and research so much, because you get these bright, curious, amazingly intelligent people interacting and brainstorming, and you can do some of that on Zoom, but I can tell you, you cannot replace the person to person. Nothing like a cappuccino and sitting across a really bright person and brainstorming around a research idea.
I'd like to say over the past few months, it's time to check in on your extrovert friends, because we are really struggling throughout this to not be able to hang out with people. Dr. Nicol, what about you? What has been something you're either going to really remembered from this pandemic or something that you've really missed over these past few months?
So Dr. Klassen summarized my professional thoughts about it, like to a T. Personally, like the thing that I find most challenging right now with COVID-19 is that I'm an American and my partner's an American, and we can't go see our family. So we've had to cancel 4 trips already, and it's looking like it's a long-term separation. And so that's become increasingly challenging for us as milestones are being met down south, and we can't be a part of that.
Yeah, I get that. There are some things that really FaceTime cannot really replace, like being there in person. I felt the same with my family in Vancouver. FaceTime isn't quite the same. So I'm hoping that you guys come up with a vaccine very, very soon, selfishly. Dr. Kelly, what about you?
Well, I am 6 months pregnant with a 2-year-old at home, so working from home, everything is a challenge, hence why I'm in the office today, actually. But overall, you know, besides obviously missing, you know, coffees, Terry's office is right behind that wall there, and, you know, the social interaction. I mean, for me, the most difficult thing is that I have a whole research program that I'm still trying to keep going and running these COVID trials on the side. And I have 2 international students, both of which who are working on really important projects, but in totally different time zones, you know, and trying to communicate with them and engage them, even though we haven't even met in person yet. And so onboarding, I think, new research team members without that face-to-face going for lunch, like our typical usual social events, I think has been really something I'm not gonna look forward to. I look forward to ending, let's just say that.
You are a superstar for the research you're doing. The fact that you are pregnant doing all of this with a toddler, I commend you. That does not sound easy. Dr. Azad, what about you?
Yeah, I mean, all of the above. So I normally probably spend about 25 or 30% of my time traveling. So I think I stopped counting after 17 trips canceled. So that's certainly been a bummer. I like traveling and haven't been able to for work, but we've also had, my husband is from Kenya, and we had some family milestones over there that we had to pass on. And yeah, the research program, I mean, I described how our child study had to shut down. It's now started up again in a modified way. So just figuring out the logistics of all that has been a challenge. And then meanwhile, starting up a new COVID project. I have another COVID project, but all the other research continues. It was kind of misleading at first because everything kind of slowed down, and I thought, oh, I could start 2 new projects. And then, but now I have, 10 projects, and it's hard to keep up, and people are all over the place. But I have to say, I've been really impressed with sort of the resilience and adaptability and flexibility of the research team. My trainees are doing awesome. Everyone has really adapted pretty well to this new normal. So that's been motivating to see, and the entire university as well. I'm hoping that some of the pandemic shifts will stick around after. So, ethics approvals come through faster. They let us submit things online. Like, these are all great things that I hope will continue later on.
You guys are making me feel very lazy. I have no children. So the work that you are doing on top of everything else, I don't know, maybe I need to take on a second or third job to just keep up. I'd like to bring Stefano Grande back now to close out our panel.
Well, this has been just a tremendous hour here. Just thank everyone for the fantastic information and this conversation. We hope all of you, our donors and stakeholders, have enjoyed this opportunity to hear more about COVID research at CHRIM. And it's very real, it's very special, it's very relevant in terms of the impact of kids and families everywhere, not only here in our province, but nationally, internationally. Brittany, thank you for your time and support in moderating this event this evening. Thank you for your deep questions. And thank all of you, those out there listening to this panel discussion. On behalf of all of us here at the Foundation and at CHRIM, thank you for everything that you do. Thank you for supporting our kids across Manitoba. Your generosity is making a difference every day, particularly this year. Together we can make a difference, and we can make anything possible. So thank you again, everyone, and have just a wonderful evening.